thank you for coming on the show again. I just want to take some time out of it just to say thank you. I truly appreciate you coming on, taking time out of your busy day and talking about midwifery, nursing, pregnancy, and all the related subjects which goes along with it. My first question for you is, because I know you have a vast knowledge of nursing and being in nursing, teaching nurses, I would just like the audience to know how much experience you do have and you are someone to listen to about this subject. Could you tell us a little bit about your career in this area?
Yes, thank you, Alan. I'm excited to share my experience. I'm a registered nurse and midwife. I've been in midwifery nursing for 20 plus odd years, including working up in the Northern Territory, doing some Aboriginal midwifery, which I absolutely loved. My best friend and I, she came up to the Northern Territory, and we did some midwifery there.
So not just in the cities, but also rural
Yes.
background areas.
Yes.
I also believe you taught at some universities, such as RMIT.
Yes, I did some teaching as well, and at ACU I did some midwifery teaching there as well, and mostly in the labs, in the labs and assessing students, but potential midwifery.
What did you teach at RMIT?
Well, at RMIT, I was more a clinical placement coordinator, but I did enjoy teaching cultural studies, including First Nations studies and history, and particularly working up there, working and living up north. That came in handy in teaching these students my own lived and skilled experience.
You also worked at the Royal Children's Hospital in Australia?
Yes.
What did you do about it?
Once again, I was an educator with teaching the third year nursing students at the Royal Children's Hospital, and I also worked in special care nursery at the Royal Children's Hospital. That was interesting. I loved that. I think that's my favourite area, special care nursery.
And how many years have you been nursing specifically, and then in the high risk pregnancy ward?
So in my day, in the older day, once you finish your general Bachelor of Nursing or Health Science, which I did, you had to have some gained experience and then go off and do your your area of interest. So my area of interest was paediatrics, then midwifery. Then I went off to do midwifery.
Awesome, extensive career. All right, so let's dive into it. My first question is, a couple of days before delivery, what is the mother feeling like? Are there any signs that one can tell that delivery might be approaching, or is it just comes on all of a sudden?
Okay, that's an interesting question, because there are misconceptions, and it's not like the TV where it's all sudden you have one contraction and the woman delivers. We have to remember each experience is different, each labour is different, each pregnancy.
Humans are so vast and complex,
absolutely,
and so varied that
each pregnancy, there may be some signs that the woman will go into labour. What we call a show may present. That's a sticky discharge. Waters may break. If your waters break, doesn't necessarily mean that you will go straight into labour. If the waters break, we usually like women to come in and we'll assess them. A couple of days later, there might be some back pain, some Braxton Hicks, which are contraction-like pains, but remembering that contractions tend to be more regular, where Braxton Hicks you might have one and then that disappears and it goes away, and then you'll have another one.
Alright, so let me create a scenario for you. The father and mother at home, relaxing, big belly, and then all of a sudden contractions. How does one know that she is going into labour?
So if it's the first pregnancy, what we call a primip, if it's the first pregnancy, usually the body will take a little bit longer to go into established labour, and remembering that labour can be anything from a couple hours to 24 hours, particularly if it's the first time pregnancy and birth. So what we like to see, or what we like to tell women when to come in, is if they have 3 contractions in say 10 minutes. If all going well, so we ask other questions like, are they bleeding, do they have any other signs and symptoms, are they feeling well in themselves, if they have any discharge, and the colour of the discharge. So if there is a concern there, if there's anything of significance, then we ask the woman to come into labour. But usually if the pregnancy has been a nice, simple, normal pregnancy, then we'll ask the woman to maybe have a shower, and to recall us when they have 3 contractions.
All right, so water breaks, 3 and 10, 3 contractions per 10 minutes. The partner freaks out, the mother freaks out, they hop in the car, they drive speedily towards the hospital. Once they get in the hospital, what occurs? What do nurses?
The midwives.
The midwives.
So midwives will take care. So particularly if the water's ruptured and the labouring person has 3 and they're contracting, we'll take them straight into the maternity ward, onto their bed, so into the birth suite. We'll take them straight into the labouring ward, and we'll assess their discharge, the colour. As I said, anything untowards, then we will start acting on that, and it just depends on the scenario. If it's clear, then we'll pop the CTG on. It's monitoring fetal heart rate, and we'll see how that's going. Usually we may do an examination, see how far along the woman is. But otherwise, if there is no significant medical or obstetric history, then we'll let the woman labour.
So she's gone to hospital. Some nurses and midwives have done some tests. How long should the woman expect to wait until the birthing process occurs?
As midwives, we say if we knew the answer to that, we would be millionaires. We don't know. We don't know how long it is, and there are some variables that come in. For example, if it's your second baby, labour tends to be quicker. If it's your third labour, then it's much quicker, of course.
For the first pregnancy, how long would it? I guess it could last from as early as like an hour or as late as
24 hours, but be mindful that if your waters have broken, then we usually won't wait 48 hours. We'd start maybe inducing the labour. But if there's no waters broken, the woman's all normal pregnancy, we'll listen to the baby's heart rate, if she's contracting, those regular contractions, possibly a shower, the warmth water. Another misconception is you have to labour in bed. We ask the woman to move around, maybe on the birth ball, or squatting, different positions. We need to let gravity do its work and deliver the baby.
I've heard that some women elicit to choose certain positions or some scenarios, some aspects which she can choose how pregnancy runs. Is that true?
Okay. That's, I believe you're referring to a birth plan. So a birth plan is a woman's preference. A birth plan, the family get together and they discuss what they would like to do with their pregnancy, the positions. Once again, being mindful that the birth plan is a preference, and as midwives, we will follow that birth plan we need to be mindful that flexibility has to come to play as well. We need to be flexible in that if there, for example, if the baby's heart rate drops, then we need to possibly pop that CTG on a more regular basis rather than monitoring it every so often.
All right. So the baby's coming. They're scrambled into the room. The nurses, midwiferys, the midwives are around. What occurs? Can you explain to the audience what then occurs?
So there's a couple of stages in labour. A baby doesn't come. There's first, second, and third stage of labour. The first stage of labour is the woman contracts. One of the signs is they can contract regularly. Once again, it's not like the movies where you have a couple of contractions, the baby's out. There are stages of birth process, but if the woman is 10 centimetres dilated and she has that urge to push, then we let nature take its course, and the body knows what to do. Hormones, beautiful hormones, oxytocin plays an important part in the contractions, and we monitor the descent, baby coming out, we deliver the baby. And
once the baby's delivered, what types of checks do the midwives?
So once the baby's delivered, we like to put the baby chest to skin to skin onto the mum. We do the cord delay cutting. We cut the cord and pop the baby onto the mum's chest, and we deliver the placenta. We keep the baby warm. We rub the baby a little bit, and breastfeeding is really good to pop the baby onto. Breastfeeding helps the uterus contract and deliver that placenta.
I've also heard skin-to-skin contact is very important.
Yeah.
So correct me if I'm wrong, once the baby's delivered, the baby is never taken away from the mother and is actually given to the mother for skin-to-skin contact to initiate the neurochemical release.
Yeah. Even before the placenta's delivered, even before the cord's cut, we like to pop the baby onto the mum to release those love hormones, those happy hormones, the oxytocin that helps with the bonding. It's an evolutionary design.
Is the baby ever taken away in eyesight from the mother? Is it ever taken outside the room, or is it always within the room?
Good question. Each room has what we call a neonatal resus, where we have the warmer and oxygen in readiness in preparation for anything that goes untoward. Babies do not get taken out, but some babies can become stunned and flat at birth, so we give them a really good what we call tactile stimulation, and we visualise the APGAR scores. So if the APGAR scores are high, we do a bit of tactile stim.
What does a high score mean for the audience?
High score is 9 and 10. Anything below 6, a lot of policies, anything below 5, 6, we will be a little bit concerned and maybe possibly call the paediatrician. So the APGAR score just scores the baby's heart rate, respiratory, their floppiness, their activity, their crying, their colour. So we check all those to make sure. If we're a little bit worried, we will take the baby to the warmer, always with consent, and the partner or the support person can come with us. We check the baby and describe what's going on.
Once the baby's delivered, all the checks are done. 10 out of 10, beautiful baby. The mother gets moved to a separate room, I assume.
Yes, they go to the maternity room to recover. They're usually there for 24 hours. A normal vaginal birth is 24 hours. In a public hospital, private hospitals, I all believe are a little bit different. They get a couple of days extra.
Where does the partner fit into all this?
Okay, so support. We support. The partner is a support person, encouraging. We always ask the partners how they're feeling, because we've had a couple of partners who do faint at the sight of sight of anything really. So they'll come around. Some partners are really involved. They'll have a look at the baby. They'll have a look at the crowning. They'll have a look at the head. So some partners are at the mum's. They're rubbing the shoulders or rubbing the back. And
how many support network peers can you have within the room for
one
delivery?
At this stage, it is one. Yes.
One.
Yeah.
Is the option to have more, or is that a hard
No,
rule?
I think it's a risk factor safety policy. We like to have one, also remembering that there's 2 midwives, and if anything, we do need obstetricians or paediatricians. The rooms can get quite busy and quite hectic and quite full. So we at this stage, it's one. Yeah.
All right. So 3 and 10. 3 contractions per every 10 minutes, delivery's on the way, drive to hospital, wait for contractions to get even heavier, move to a birthing with midwives around, birthing takes place, move back into the hospital bed, 24 hours typical, and now they go home. What are some, I guess my question is, because it might be so stark, so juxtaposed from having no baby in your arms to having a baby, does the hospital give you anything for that transition or say anything?
It is overwhelming, as you say, particularly if it's your first. You haven't had a baby. All of a sudden, you have to take care of this little being that can't communicate with you. It's only through crying that they communicate. It is very overwhelming for the parents. So you have any questions, please write them down for the midwives, for the doctors. You will get doctors will do a day 1 check. Any questions, any information, please write them down, because it can be so overwhelming. And
So a day 1 check for the audience is a midwife who comes around the day after the birth?
Or day 1 check is usually the doctors, the obstetrician. They will come and do a full check, including fundal height. They'll check your blood loss. They'll do a head to toe check.
So not only the child, but the mother as well.
No, the obstetrician looks after the mother. The midwives, we do the day 1. We do the discharge checks on the babies.
So there's 2 people who come, or just one?
Oh, they come at all different times.
So multiple people come to you.
You will see multiple people.
And is that just the Australian option, or was it? Or is it just like private public health insurance, or is it?
No, that you'd see that in both public and private. You will have all women, all birthing people who have birthed will have that day 1 check.
For the audience, C-sections is what I want to talk to you a little bit about. I've heard online that some people suggest and go through with C-sections rather than natural births, and I just want to hear your thoughts on that.
So women need to be empowered. Women need to be empowered and make the best decision based on evidence-based care. There is no reason why a woman would need to choose a cesarean if everything is normal with the baby and the mum. Cesarean sections are surgical procedures. They require anesthesia, whether it's spinal, sometimes a general anaesthetic for cesarean. The recovery time for cesareans are longer, a little bit longer, and you have a wound post-cesarean, like any surgical procedure, like any invasive procedure. Although now, having said that, the surgical scars are so very, very small, and doctors, obstetricians do a really great job in that area. Having said that, there are times when women will need cesarean sections. My thoughts on this, and this is my personal experience, that if you do not need a cesarean, vaginal births is it's a great.
What are your thoughts on home births compared to the hospital births?
Home births. Interesting. It is interesting.
Would there be a midwife with the mother when
Yes,
it occurs, I would assume?
absolutely.
Yeah. It's not just
home,
gun-ho wife and
no.
partner.
Although there was a couple of free birthing, I think they were called free birthing in Geelong, but the outcome unfortunately wasn't that good. But home births are great. If everything's normal, if the pregnancy is normal, there's no significant medical history, no significant obstetric, no significant fetal anomalies, then home births would be a great place to deliver.
I guess I would assume there'll be more difficulties with home births compared to births.
Not necessarily. No, not necessarily. We always say when women are quite anxious and they want to come into the hospital at the first sign of labour, the best place to heal and the best place to have your baby is at home. It's your environment. Comfortable, your own setting, you're surrounded by your loved ones. The other great thing, I think, is water births. Quite like the thought of water births at nice, comfortable water, warm water, because the baby is surrounded by water. That's a beautiful thing. Unfortunately, I don't have that experience to be either a home birth or a water birth midwife. So.
Because I have heard online that some women choose C-sections rather than natural births for aesthetic or other reasons.
Yes.
And I just want to go further on that topic about other potential misconceptions online or other things which might seem a bit curious to you, if there's anything pop into mind.
That is very curious and very sad. I did read the 2012 research the American Obstetric Society did about women choosing cesareans so culturally and feminine for cultural aesthetics value, and it's apparently more pleasing to the man, which is quite misogynistic, and once again that empowerment for women, very cultural. But vaginal births not necessarily mean that it's looser. You can have looser organs with a cesarean. That's where physiotherapy helps. Your exercise, your pelvic floor exercise. So this research was quite an eye-opening, and I'd never heard of that before until we spoke about it before. Yeah. So
what other misconceptions? So moving away from C-sections and all that, what other, like, Instagram, TikTok, other misconceptions out there? Because I do believe there is probably a lot, but I'm not too well versed on the current midwifery TikTok streams of.
I think we have to remember that each of our experiences are all different. Just because you see someone on Instagram recovered really well from their birthing, that is not your lived experience. You have a different experience. You've got different emotions, different resources. So to see, I do see these women after having 4 babies and they're often, looking beautiful. That's great that they can do that, but we must remember to be kind to ourselves, to be kind to our bodies. We've just had a baby. Our experiences are different. We may not have all the social supports. We may not financially not be in that position to go off to the gym so someone else can look after our babies. We need to be kinder to ourselves. As women, we need to be more... we need to have... As women, we need to be more supportive. And I think that's we're doing that. We're doing that a little bit better.
I've heard online that women who go to the gym during pregnancy activate some sort of gene, epigenetic system within the baby, which promotes muscle growth later on in the child. Is that true to your knowledge?
I'm sorry, Alan. I'm not very well educated in that area. But
I'm just picturing like a hulk of a child coming out of the mother's womb.
I don't. I haven't delivered a lot of athletic bodybuilders, so I don't know the research. I'm not well educated in that area. I cannot comment. Interesting though about going to the gym. So if the woman's been going to the gym and she's pregnant, there's no reason why she should not stop going to the gym. But just be wary and talk to your doctor and midwife that you don't start suddenly going to the gym when you're pregnant, or you don't start running. But if you've been a runner, run. If you've been going to the gym, go. If you've been a swimmer, swim. What I think the research is suggesting that you don't start doing these things whilst you're pregnant.
Yeah.
Suddenly want to swim or do a marathon. But if you've been doing marathons and now you're pregnant, do your marathons. It's,
awesome.
Yeah.
Diverging a little bit into more food. What foods do you suggest that women eat during pregnancy? Is there any ones that would benefit the child, the mother, anyone that steps out of the pack?
Another interesting question, and always take the advice of your midwife and doctor. My thoughts on this is that if you've eaten soft cheeses and if you've eaten salamis, then I see no reason why to. If you've come from the Balkans or the Mediterranean area where you're eating all those, then...
So if you have a long history of your ancestors eating the foods, there should be no reason why you can't.
I would think not. I think your body's well evolutionized to tolerate that. But once again, use judgment, critical thinking. If if there's chicken or cheeses that have been out in the sun for very long time, that probably not. But if you've been eating those, and if you've been eating curries and you're from a culture that eats it, I absolutely see no reason why not to continue that. Once again, always take the advice of your midwife and doctor.
What are some foods which you recommend not to digest or eat during pregnancy? Is there any ones to stay away from?
I think research suggests just some raw meats, raw fish, sushis. I think that's what they're saying now.
Is that just online, or is it backed up by scientific evidence?
That's...
no stress.
I think that may be backed up by scientific evidence. Just anything raw that hasn't been cooked. There is some research to suggest pregnant women may not.
Yeah, removing some microbiomes on it.
Possibly, yeah. Just reducing that salmonella or food poisoning.
Speaking about foods, microplastics. I've looked into microplastics a little bit. I know from literally you absorb microplastics subdermally, orally. You absorb it through the skin contact from clothes, you drink it through water bottles. I was just wondering how and if that could affect the children and the mother and the whole process of pregnancy.
That is a really interesting question. I love that question, and I wish I'd known more about it, but once again, I'm not well educated to discuss this. But you can always ask Victoria. She's got her master's in marine biology, and she's studying plastics in water at the moment. So that's one topic. That's a really interesting question, and I know there's been research into microplastics, but not too sure about how it'll affect the fetus.
Because I read, I believe, Countdown by Shannon H. Swan, where she looked into how microplastics affect sperm count, mutations in sperm, and due to the effects of microplastics can statistically potentially cause alterations in pregnancy, the child later on in life, but not just that, but also plastics moving from the blood to the brain, passing through that barrier.
That's an interesting research. Haven't read anything about that. I do believe there was a research about the vitamin A cream.
What about the vitamin A cream?
Vitamin A cream may affect fetal development and can absorb, but once again, that research was fairly new, and there was beginning of research of.
Do you recommend? Sorry for interrupting, but do you recommend doing anything else during pregnancy? So, from what I've heard online, you can also listen to music. Maybe, is there any like unique actions one can do while pregnant?
Whatever the family unit
has been doing, and whatever
makes them feel comfortable during pregnancy. We like to have the lights dimmed, some music, some aromatherapy, and be mindful of some scents may affect pregnancy. Some scents are not to be used during pregnancy, and please don't quote me, I'm not too well versed in what scents and what aromatherapies can be used, so please check and double check with your midwife and doctor on what scents can be used and can't be used during pregnancy. But lavender's always a good one.
All right. I think we might wrap it up there. Just for the audience, if they have any further questions, are there any sites or places where they can go?
So once the family is discharged from hospital, they will be visited by the midwife, maternity in the home, and then they will be connected with their counsel, maternal and child health nurse. So any questions, please refer to those resources, and also Breastfeeding Mothers Association. That's a really great resource that I was involved for many years. The resources Panda, the postnatal and antenatal depression, and always seek help, seek advice. You're not alone. Discuss with your family, with friends. You can always drop Alan a line, and he'll pass on some questions that I might be able to answer. Resources if you've got any other questions. I'd love to hear from you. Yeah.
You're awesome, Mum.
Thank you.
Greatly appreciate the time taken out of your day to come on.
Thank you,
and
Alan.
talk to us.
I'd
Thank you so
love
much.
sharing my experience.
Awesome.
Thank you.
We'll call that a wrap.